Abhi aa gaya the next favorite topic, epinephrine, which is not given in anaphylactic reaction. You don't give transfusion. You'll give beta adrenergic agonists because they are bronchodilators, antihistamine and epinephrine. For a life-threatening allergic reaction, what do you want to give? We want to give adrenaline. Philipressin hota hai vasopressin, vasoconstrictor. Which hormone may be associated with an increased sensitivity to epinephrine? Those who have hyperthyroidism. Why do they get arrhythmias? Because hyperthyroidism leads to increased cardiac sensitivity to the arrhythmogenic action of the epinephrine is what you have to emphatically remember. Now, it is not an action of epinephrine when you happen to administer it intravenously in a high dose. So you should remember epinephrine increase liver glycogenolysis, evokes extrasystoles, it produces restlessness, anxiety. They're all true statements. So doctor, you should be sure epinephrine versus non-epinephrine. What are the differences? We will discuss that. So what are the contraindication for a vasoconstrictor? If there is hypertension, myocardial infarction, thyrotoxicosis, they don't give a vasoconstrictor to worsen.